According to Albert Einstein, life is like riding a bicycle. To keep your balance, you must keep moving. Monique Williams keeps moving, and that's one reason she was selected for the Arts and Sciences Early Career Achievement Award.
I've loved WashU since I was in elementary school. My dad was appointed as the Dean of College of Arts and Sciences when I was 7 years old. So I used to always tell my friends, my dad has the coolest job. He gets to work with students, be involved in education, and he works in a castle. And I remember one time I had to do an article about a field of work that I wasn't familiar with. So I did an article on archaeology, and one of the professors actually let me interview her, and then I wrote her a thank you letter, and she wrote me a thank you for the thank you letter that I still have in the top drawer of my dresser because it was really kind of inspiring to get such a positive letter from a faculty member.
Dr. Williams cannot remember a time when she did not want to be a doctor, but she also found that studying French literature provided great preparation for a career in medicine.
Even though I decided I wanted to be a geriatrician when I was 4, I had also decided that I wanted to continue to study French as long as I could, so I did the double major in French and biology. You learn quite a bit about the impact of disease in French literature, so kind of allegories for disease, the experience of patients with chronic illness, and a lot of metaphors for disease. And there's also such an emphasis on language and the nuances and relevance of words, which is very important as a physician when you're trying to convey something. It seems unusual to combine the two, but a Romance language plus pre-med is actually a very good way to get a balanced approach to patient interactions. I took Spanish in U College as well in anticipation of taking medical Spanish courses, and some of my friends from French class were in there, so we had to remember not to speak French in Spanish class.
Monique was really bright and very well prepared, very incisive, and she loved learning French.
People were very helpful during office hours. They would not only be aware of your academic accomplishments, but also, did you have balance? What were you doing for fun? And, what did you have planned in the summer to advance your career but still get some downtime? So that was always a very positive culture.
Today, Monique Williams is a physician, clinical research scholar, volunteer, and community advocate. One of the reasons she keeps moving is that she sees disparities in medical research and patient care.
If you look at dementia in general as compared to, say, cancer or other terminal illnesses, people with dementia are less likely to be receiving hospice and palliative care services than people with other diseases such as malignancies or other neurodegenerative disorders. And if you look at that group, African Americans and Hispanics are even less likely to get those services that have been shown to improve care at the end of life. When I was a senior at WashU, I started doing research dissemination, education, and outreach. And I think that's really relevant. So not just doing the science, but bringing it back to the community, which often brings up new, interesting questions.
I think she combines a real curiosity about lots of things, and obviously about science and medicine.
Regardless of the discipline, whether it's language or whether it's science, some people have this misperception that you can go through life as a lone wolf. But one thing that WashU emphasizes is the importance of having good collaborators.
I love her joie de vivre. Joie de vivre means joy of living, and I think of that as a real characteristic of Monique.
Eh bien, je dois dire merci beaucoup à tous mes professeurs et tous mes collègues et tous les étudiants pour cet honneur incroyable. Merci beaucoup.